Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Friday, March 27th. My name is John Bradford. I am a small business owner of two businesses right here in North Mecklenburg and Cornelius. I'm also a former member of the North Carolina House of Representatives. I am your briefing call moderator. I want to just go through the purpose of our call. This call is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to help educate, update, and support the North Mecklenburg region during this outbreak. A couple things. The president on March 16th said we need to have 15 days to slow the spread. Today is day 11 of that 15 days. Obviously, there's nothing magical about the 15 days, but we are in day 11. So remember, if you feel sick, please stay home. If you're older, please isolate yourself and stay away from others just to protect yourself. If anyone in your household feels sick, please isolate them and call your doctor. On this screen, you can see the CDC website as well as the coronavirus.gov website. Those are great sites for information, so please go there if you have some questions. The next screen, you'll see this is a map, a heat map of the United States. As of yesterday at 4 p.m., there were 68,440 cases, and there have been 994 deaths here in the U.S. Of course, this data is already old because this CDC reports this at 4 p.m. every day, and this was 4 p.m. yesterday. Every jurisdiction, including Puerto Rico, District of Columbia, Guam, and the Virgin Islands, have reported cases. Just a few federal highlights. We covered this on our last call, but these are important reminders. Federal taxes are now due July 15th instead of April 15th. The North Carolina Department of Revenue will not impose late penalties for taxes that are due April 15th if they're paid by the 15th, although that does not necessarily get you off any interest. I do know, I have confirmation from the North Carolina General Assembly that they are working towards a retroactive bill that would work on waiving interest as well. So stay tuned. As we know more, we'll report it to you. All interest on student loans are being waived for the next 60 days. And also federal standardized testing is not going to be enforced by the U.S. Department of Education, and the Real ID deadline has been pushed back. FEMA has a rumor control website. Here's the address. Please check here periodically. This morning there was a new rumor, so I'm going to share right here on the screen. The new rumor, here's the myth. A recent death reported in China was due to a new hantavirus that can spread from person to person, just like COVID-19. And that is a myth. Here's the fact. Hantavirus is not new. According to the CDC, it was first observed in the 1950s in Asia during the Korean War, and as well as in this country in 1993 in the Four Corners area. It is spread primarily to humans through contact with the waste products of infected rodents. Transmission from one human to another may occur, but is extremely rare. And then it gives you the CDC website to visit. So that's a new rumor that's out there, and they have addressed it. The other rumor that I love to cover is if anyone is telling you they can get you money right now, it is a scam. The government is not sending checks. So if someone tells you they can send you a check, it is probably a scam, and you need to check with official sources. On your screen, you have the COVID-19 call center as well as the North Carolina Department of Health and Human Services website. You can text 211 for COVID-19 assistance, although they will not give you any medical advice. And you can also text COVID-NC to 898-211, which is right here on your screen. The COVID case in North Carolina continues to climb. There are now 763 cases. There have been 3 reported deaths. The other day when we did our call, there was just 1 death. So now we're up to 3. And this was as of 11:40 this morning, so just about an hour ago. Here's a new data point. This is regarding North Carolina's hospital bed count. We have 3,223 intensive care beds, and 724 of them remain empty. And we have over 21,000 hospital beds, of which 7,000 remain empty. And this is based on 81% of hospitals reporting data. What's very interesting to me is only 77 hospitalizations for COVID cases. So only 77 hospitalizations right now because of COVID-19. I'm going to show you a series of maps, and just watch this white area on the screen in front of you change blue. This map was all the counties in North Carolina on March 17th. Now you can see it starts to get a little more blue here on March 19th. It gets even more blue on the 25th, and now on the 27th, it's even more blue. We now have 61 counties impacted out of 100 counties right here in North Carolina. The governor made an announcement yesterday that parents who need food assistance for their children can text Food NC to 877-877. Okay, last thing, we need volunteers. If you are a medical, clinical support or a clinical physician and you want to volunteer, please go to this website and volunteer. We need your help. There is still no statewide shelter in place. If you think you have an essential business, please email this email address with the information below to tell them that you think your business is essential. But as of today, there is still no statewide order in place. Here's an unemployment website. So for any unemployment related matters, whether you're a person who lost your job, has reduced hours, or if you're an employer, please go to the North Carolina Department of Commerce. The website's on the screen here for help with any questions regarding to benefits as a function of COVID-19. The Mecklenburg County stay-at-home order is in full effect. It started yesterday at 8 a.m. and it goes through April 16th. Of course, it could be extended. We don't know. And just remember, all Mecklenburg County residents are to remain in their homes with the exceptions of seeking medical treatment or buying food or exercising outdoors. Essential workers are still allowed. And lastly, here's a map. We have 259 cases in Mecklenburg County. Davidson remains the only zip code, it appears, that does not yet have a reported case, although this is changing every day. And so you can see the heat map right here on your screen where Mecklenburg County is absolutely impacted almost everywhere. Now, we're going to turn it over. U.S. Congressman Greg Murphy may or may not be on the call. Greg, are you there?
I am.
Oh, wonderful. Thank you. I know you're about to go in the chamber to vote, so I'm going to turn it over to you and let us know what's going on there in Washington and from a medical perspective.
Well, thank you, John. I appreciate, again, the leadership that you're showing to try to educate the community. That's the #1 tool we have to fight against this virus and this epidemic. I literally just stepped out of the chamber. We're about to finish within moments the speeches that have gone on. And then what will, the way this will proceed is the House will take a voice vote. There has been a rumor, actually not rumor anymore, that the one person will object to the voice vote. It has to be seconded for a roll call to occur, but a quorum is present. I don't hear of anybody seconding it, so hopefully we'll have to pass the bill. I will tell you there's a lot in this bill I do not like, the majority of which that had been put into it previously has been removed, but there are some things that I do not like. The main thing is this is not a stimulus package. This is a stabilization package for us to get through the next 2 months and then get American businesses going again. I urge everyone, I urge business owners to keep their employees on. There are resources available to you, keeping your payroll tax and not having to pay it right away. And then small business loans that if you keep your employees employed are forgivable. So please, let's keep America employed so that when we get through this, we'll be able to be strong and continue the prosperity that we had prior to this. From a medical standpoint, I think we're not really changed from the last few days. Again, it's going to be a while till there's a vaccine out. Medications are being looked into. Don't know if this chloroquine, the hydrochloroquine thing is going to work out because there's some studies now that are not being able to replicate the initial results from France. Remdesivir, an antiviral, is showing some promise, but would take time to crank that up. And there are also some plasma-related antibody infusions that may also be helpful. So again, the best thing we can do is prevent, keep people apart. Social distancing, I think that is helping. I will just throw in one thing different here, that the difference between Washington State and New York State is the following. Things started out in Washington. That was our first virus infection, but it came out as one single individual. And if you imagine somewhat of a starburst pattern, it popped out from there. The problem was in New York is we probably had several hundred individuals. So there are several hundred starbursts that burst out, and containing the virus there in such a high density situation is very, very challenging. So, guys, we're going to get through this. It is not a time for panic. It is a time for communal unison, and we appreciate all your support. And John, again, thank you for doing what you're doing. This is very, very good, and I appreciate you allowing me to be on the call.
Absolutely. Thank you for what you're doing for the state of North Carolina, for our country. Stay safe and healthy, and we hope to hear from you some next week if you're available. Thank you, Congressman Murphy. Moving on, you're very welcome. Thank you. This screen just shows that Thomas Stith, who's the North Carolina District Director of the United States Small Business Association, is one of our briefing panelists. He joins our calls every Wednesday. I'm only showing this screen because you see the SBA disaster website, as well as now I've added the disaster loan website. So if you're a business, please take advantage of these opportunities so that you can get yourself some bridge funding, some capital to keep your business and payroll going. Now I'm going to turn it over to Dr. Jack Faircloth, who is with Holston Medical Group, he's right here on the ground in North Mecklenburg. Dr. Faircloth, the microphone is yours, sir.
Okay, thanks, John, for having me. And I just want to say that as all the calls have gone, including what's been said today, I agree totally. My message today is that the national news and media portrayal of the healthcare scarcity does not reflect our area. The national media's focus on hotspot areas does not apply to our area, North Meck or Mecklenburg. Doctors are open for business using telemedicine, and that I do agree still wholeheartedly with staying at home. So let me just comment. So the national media has talked about ventilator and hospital scarcity. We totally agree that in certain areas this is absolutely the case, but we're very fortunate that as of today, like you said, we have a tremendous quantity of resources in our hospitals, even in our doctor's offices. I talked to an ER doctor today. I've spoken to hospital nurses, hospital physicians, and it's eerily quiet. They have ER volumes are estimated to be down about 40%. Primary care offices and urgent care offices are way down. We're all open for business. We desperately want to help, and we don't want people to avoid accessing us through a phone or through a telemedicine portal so that we can continue to work for them. Besides that, I'll just say that yes, there's 260 cases in Mecklenburg. I was incorrect last call, but 260 cases. What that means realistically is using the best modeling from the University of Pennsylvania School of Health. We think this true number in Mecklenburg is somewhere around 1,800. So we think the testing rationing that's going on is not giving us a true number. But at the same time, that true number, if you multiply it out by a factor of almost 7, we still are only dealing with at a total of maybe 1,800 cases in Mecklenburg. And then I'll just end with staying at home saves lives, checking on the needy saves lives. If you have to go out and it's essential, again, continue to social distance, wash hands for 20 seconds. But really, for the majority, we should be at home in Mecklenburg County, and we expect it not to be more than weeks that we will hopefully continue to avoid being a hotspot. Thank you.
Thank you, Dr. Faircloth. And once again, thank you for being on the front lines. Please express our appreciation to all the clinical personnel, the clinical support, first responders. Thank you for what you're doing. We cannot do this without you. So moving on to Mecklenburg County Commissioner Pat Cotham. Pat, we're obviously on a stay-at-home order, so we'd love to hear an update from you, please.
All right. Well, thank you very much. I just wanted to, we've heard that number 259, but I think it's important to remind people that yesterday the number was 204. So that was an increase from yesterday, 204 to 259. I did want to talk about the county operations are at this point are 80% virtual. I've had a lot of questions about Park and Rec, and the parks are open in the greenways. The playgrounds are supposed to be closed, but we have heard information from our residents that the playgrounds are still being used in some cases. So we are trying to address that today to make sure that children do not go on the playgrounds. The boat ramps are also open. Our health department has consolidated. So the one on Beatties Ford Road, just north of Interstate 85, is open. The other one on Billingsley Road is not open. I also wanted to report that I've had questions about golf courses, and they are open. And the county, the health department would like no more than one person in a golf cart, and if there's a pro shop, just one person at a time in a pro shop. This is important. We are hearing there's going to be some important information from the governor today at 4 o'clock at his press conference. So I just urge everyone to listen to that today at 4 o'clock. I've had calls from companies that supply meat and other foods to restaurants, and of course restaurants aren't buying it, and they are trying to get permits to sell to the public. That hasn't been resolved yet, but it was kind of interesting to hear that. We want people to know the child abuse hotline. During difficult times like this, if there is an abusive person in a home and everyone's together, 24 hours a day, it can sometimes become volatile. And that goes for domestic violence as well as child abuse. Our child abuse hotline is 980-314-7700. Let me repeat that, 980-314-7700. If you see anything that concerns you, please call that number. I also want to tell you that in the last 2 days, I have focused heavily on two big industries. One of them is real estate contractors. As they go through this order, I spent a lot of time on that and will continue to do that. And also car dealerships. I know a whole lot more about car dealerships than I did when we spoke the last time, but I'm getting great response from car dealerships, their principals, their managing partners, and so we're trying to, iron out some problems, but we are optimistic and we're getting support from the state on that. So one thing I am impressed how when people call with questions, they really want to comply. They just need a little clarification. I haven't had anybody really say to me, I'm just not doing this. Everyone wants to comply and be safe. And I would just remind you, as I mentioned the other day, a lot of people are very nervous and scared, and please check on people, give them a call. A lot of people need some hand holding. That would be virtual, of course, in this environment, but do reach out to people and just check on them, and especially seniors who are alone, as they often don't have access to the internet and they're just, they can't get out. So thank you very much. That's my report from the county.
Thank you. Thank you very much, Commissioner Cotham. We appreciate you and everything you're doing for all of Mecklenburg, including North Mecklenburg. So thank you. Stay safe and healthy. Moving on to Cornelius Maher, Woody Washam. Mayor, we'd love to hear an update from you on from a Cornelius perspective.
Thank you, John. I'm happy to provide that. We had a unique experience today having our first virtual Zoom town board meeting. It was early this morning and it went well, so I think that's going to be the new normal for us for just a little while, but we now know we can function that way, so that was a good experience from that standpoint. In addition to that, we're really trying to emphasize to our residents to stay at home and honor this order and not try to figure out ways that you can beat the order, but just honor it, stay home. It's really, really for our citizens' own good. So we're really trying to emphasize that particular fact that is going around right now. We continue to work well with the county. I get a lot of questions about Lake Norman. Is it open? Is it not open? Can we access it? And all that. And of course, we can access it. The social distancing rules apply as well. And we will be enforcing those through our Lake Patrol and other entities in an appropriate way. I did learn out of all this, if it hasn't come up on this call before, that there is a number at the county level you can call if you notice large groups congregating and things of that nature that you know is not appropriate. you can dial 311 very easily, 311. It'll take you to a county live person where you can report whatever is going on. If it's in Cornelius, they will refer that incident and that situation back to the Cornelius Police Department for the local authorities to deal with. So I think that's a good thing, particularly as we're going into a warm and sunny weekend. Folks are going to want to get out. They just need to be appropriate in this process. So that's something I think is important with our 75 miles of shoreline in and around Lake Norman area. In addition to that, we still continue to have some major wonderful acts of kindness going on in our community, with chaplains and other Cornelius residents reaching out to the community and supplying food to anyone that wants it, and especially to the elderly and small children in our community. Our police and fire departments are being well fed by local restaurants like Lake Norman Chick-fil-A and Pita Pit and Crafty Burger and others. So that's a good thing. I actually had a call from Sheriff McFadden a day or two ago offering additional masks to our police officers who were running low, running short, maybe even out. So everybody's working together as it relates to our public safety officials. You know, we've received all kinds of masks and gloves from other Cornelius businesses as well, like one of the local spas and eyelash brow and companies and things like that all around town that have these masks. So, you know, everybody seems to be pulling together. Actually, Carolina Springs Auto Spa has offered to disinfect our police vehicles in order to keep our vehicles safe should they get exposed. And one of our florists here brings flowers to our fire department to keep them brightened up over there. And those are just a few examples. They're going on everywhere. You know, we encourage our folks to continue to touch base with our elderly and folks that are so susceptible to the COVID-19. We're very worried about them. Hopefully they'll stay in, but they need to be checked on at the same time. And just to ask everybody to encourage your friends and neighbors to stay at home during this particular time. You know, we'll make it through this. There is another side of this experience we're going through, and I think we're all going to be better for it. Thanks.
Okay, thank you, Mayor. Appreciate that update. So now we're going to move to the town of Huntersville. We have Mayor John Aneralla with us. Mayor, the microphone's yours.
Yeah, hey, thanks, John. And I'm going to just continue to reiterate what Mayor Washam has stated. The continued acts of kindness makes you really proud to be the mayor of a community that continues to reach out. Similar to Cornelius, our first responders are getting well fed and taken care of. I would mention, don't forget our first responders at hospitals as well. One of our churches coordinated with CMS to ensure that an apartment complex in Huntersville was getting deliveries. They are a lower income area and just didn't have a lot of ability to get out. So the churches are pulling together, the citizens are pulling together, and you know, just couldn't be any prouder. Next week, Monday, Angels and Sparrows will be reopening for drive-through only, Monday through Friday from 11 to 1. In addition, I'm sure many other charities are in need of your support. So if you have additional supplies, or if you can go to their website and volunteer or donate, that would be great. In terms of the stay at home, I think, you know, like Commissioner Cotham stated, we're hearing from some of the industries that are a little bit gray right now in terms of what they should and shouldn't do. And what I will tell you is, as mayor, I'm taking my cue from the county and the governor and the president, and we don't have real discretion on what we can and can't do at this point. If you have some questions, the town's website, Charlotte's website, and the county's website all have frequently asked questions and answers of what you can and can't do. The phone number for that is 704-353-1926. And then what I'll tell you about our hospital here in Huntersville, they're about 45% of capacity, and typically they run at 95 to 99 plus percent of capacity. So as of right now, it's maybe the calm before the storm, but we have certainly capabilities just locally to house anybody that's suffering from the coronavirus. And then just anecdotally, I've driven by the outdoor testing center off of Sanford Road multiple times, and multiple people I know have, and we've only had maybe 2 to 4 cars at a time waiting to get individuals waiting to get tested. So I think it's very orderly. People are hopefully mostly staying home, and if they do feel poorly, they're going to one of the centers to get tested. So that's all I have.
Thank you, Mayor. Thanks for your leadership, and thank you for being a part of our briefing panel. We really appreciate it. Now we're going to go to the town of Davidson. Is there anyone from Davidson on the call? Davidson, anyone there? So for any of our Davidson listeners, I continue to reach out to Davidson, and we invite them to the calls. I'm sorry they're not joining, but hopefully they'll join one of our calls in the future. We'll continue to reach out, and hopefully someone will join. So now we're going to go to CMS District 1 board member, Rhonda Cheek. I think she might be on the phone. Rhonda, if you're there, the mic's yours. Rhonda, are you on? Okay, well, we will move now. If she's not here, then well, let's move on. We will go to Bill Russell, the Chief Executive Officer of Lake Norman Chamber of Commerce. Bill, are you there, sir?
I am here, John.
Okay, go for it.
Yeah, it's been extremely busy here too. As most people know, our chamber is right at 900 members, and we've got businesses from Huntersville, Davidson, Cornelius, and throughout the Lake Norman region. A lot of those have been calling and asking if they are essential businesses, and what are some of the plans, and how did they get to the funding, and questions about the Mecklenburg County stay-at-home ordinance. What we were able to do today was put together an outstanding special Focus Friday. It's virtual. We've been placing it on our website. It's in a lot of the social media, so you can get to it by going to lakenormanchamber.org. But it was actually facilitated by 2020 Lake Norman Public Policy Chair Jeff Hart, who's the former North Carolina Senator, District 41, and Cornelius Maher. Jeff did a fantastic job. He had Dina Diorio, who's the Mecklenburg County manager, who talked about the stay-at-home ordinance and what all it entails, and some of the repercussions for those people who are not adhering to the policy. We had Mike Riley, who not only being the president and CEO of the Huntersville Medical Center with Novant, he's also a registered nurse, so he had a lot of perspectives in terms of the coronavirus. We had Eileen Joyce, who is with the Small Business Administration, lives here in Cornelius, and she was talking about some of the issues surrounding about how to get to the funding and support from the Small Business Administration. There were a number of slides that she presented, so it's in that presentation. People can go and look at the direct links and telephone numbers. Kenny Colbert, who is the president and CEO of the Employers Association. Kenny and his organization represent about 900 Charlotte corporations, particularly their HR departments. And he spoke to mostly the larger corporation concerns as it relates to this, and some of the employee concerns that those businesses will have. And lastly, I touched on some things as well. So it was a fantastic program. We've got more programs like that. We've got a program coming up on the CARE Act from Jay Leisman, so that'll be coming up in the next week. We have more events that the Chamber of Commerce will continue to share out virtually until we're able to actually put folks back into the offices and do some face-to-face interaction. But again, as Pat and everybody talked about, it has been so nice to see the public support of our businesses. Again, the restaurants are open for business with takeout and dining. You can go to lakenormanchamber.org for those participating restaurants. We have some retailers open with some discounts that you can purchase online or on telephone. Again, go to the Chamber's website. And again, I just encourage people to continue to support those businesses who are still allowed to be open as a critical and essential business service. John, thank you for what you're doing and getting this message out. And again, on that message that we had, the Focus Friday, You can go to lakenormanchamber.org for that information, and everybody have a safe weekend.
Thank you, Bill. Thank you for your leadership, for your doing for our local businesses. It is much appreciated. Stay safe and healthy. Here's just a reminder for the Huntersville Chamber. Of course, we have made it an open invitation for anyone from the Huntersville Chamber to join, and so they know they're welcome. So I don't think there's anyone from the Huntersville Chamber. Is anyone there? Okay, no worries, but I did want to show you their website. So in closing, you know, I don't have a crystal ball, but it is clear that with the number of counties impacted, I would not be surprised if the governor's giving an announcement today at 4 p.m. This may be the last weekend that we enjoy our freedoms if you're outside of Mecklenburg County and not already under some sort of stay-at-home mandate. I would not be surprised if we go under some statewide issue after the weekend. I guess we'll know more later today, but it just seems like that's where this is heading. That would not be a surprise to me or probably to anybody else, but for any of our friends outside of Mecklenburg County, you know, I would be paying attention to what's going on at the state level, but I bet Monday is going to bring a new set of game rules for us. We are stronger together. There's no doubt about it. I enjoy moderating these briefings. Our next briefing will be Monday, March 30th. If you have any questions or if you have any input, you can email lkntogether@gmail.com. As always, I want you to stay safe, stay healthy, be smart. We appreciate all of you and have a wonderful weekend, and we'll talk to you on Monday. This concludes our briefing for today. Thank you for joining.